All right, we're live now.
Okay. Hi, everyone. Welcome to another virtual shattering session with Pre-Dental Universe. We have an exciting presentation today with Dr. Cohen, and he is a cosmetic dentist. And on that note, feel free to take it whenever you're ready, Doctor.
All right, very good. Well, thank you very much for having me. Again, I'm Dr. Dustin Cohen. I'm a general, a cosmetic and restorative dentist in Beverly Hills, California. And basically, happy to talk to you guys. I remember these days. I'll start from like way back. Back in the day when I was like 8 years old and I started going to orthodontist and I got my first blue retainer. I was like hooked. My orthodontist was kind of a big time orthodontist in the area at the time. Had a really nice office, had nice patients and nice people who worked for him, had lots of video games and fancy cars and fancy clothes and stuff. And I was like, oh, this could be interesting. As time went on, I got more and more interested in the actual science of it and everything. In high school, for instance, I worked for that orthodontist for 4 years, so I got to really understand what was going on. And I also kind of realized that maybe I didn't want to be an orthodontist, but another type of dentist. While I was in high school, I was in a pre-medicine magnet program, which basically was all I had normal high school classes, but then I had medical specific classes, and that was really interesting and a good intro into the medical field. They didn't have a dental program, but medicine was close enough. And then in high school, we did this Health Occupation Students of America thing, which I don't know if anybody else has ever done it, but it's like competitions and stuff based around medical stuff. So I won awards at both the regional, the state, and the national level when I was doing it, and so that helped to like solidify that I was kind of on the right path. Now coming to probably more where you guys are, I went to University of Florida, and I started like to like junior year, I think I was a microbiology major, and then I realized how hard it was to finish that major. And I was like, these classes are getting kind of crazy. And so I did my research and I found that human nutrition I could jump into that one, and that one's a little more interesting to me. So I got a degree in human nutrition. My grades, to be honest, when I was a kid and in high school, they were all like straight A's. And then I went to University of Florida and I did not get straight A's. So it was a little more difficult during my DAT prep, or really my application time. Again, getting to where you guys are probably close to, the DAT prep. Back in the day, there's probably a whole bunch of new stuff. This was you're talking 2004. 2003, 2004, something like that. I started the DAT prep, and Princeton Review, I believe, still has classes that you can go and take, and that's what I did. I read Kaplan books, and I'm sure you guys are probably familiar with the Student Doctor Network website, and if you're not, you should definitely be Googling that, because that gave like so much information on things you couldn't really find anywhere else. Lots of like old interview questions and just like lots of specifics about applying to dental school and stuff like that. But that first time around, I did not get accepted to dental school, and I was majorly bummed because I literally didn't want to be a dentist since I was 8. But I did not get in that time. My DAT was pretty good, I think, for the time, which is already a long time ago. And then my grades weren't great, and I probably applied to maybe like 9 schools in total, and I didn't get in anywhere. So then I said, oh man, what am I going to do? So around that same time as I'm finding out that I'm not going to get into dental school, I applied and got into Barry University, which is in Miami. And I did a master's in biomedical sciences. Basically the same type of science courses that you'll take in the first couple of years of dental school or medical school, whatever you go to. It's all about the same, the basic science courses. And I did really well grade-wise, but I took the DAT a second time and did not do much better than I did the first time. A couple of years before that, my DAT score was okay. At this point, a couple of years later, it really wasn't that great anymore. People had like elevated their scores a lot in that time. So I said, oh no, what am I going to do now? I really always wanted to be a dentist, but I started to think, if this doesn't happen, what am I going to do? Luckily, my parents at this time are helping me out. Basically, they're helping me go through the school and kind of paying for living expenses, so I'm able to continue trying to become a dentist. And then I took the DAT a third time. That time I went like all out. I like did private tutoring with the Princeton Review. I took all their classes. I did all the home stuff, and my score improved considerably. And my grades were much better in my master's program. But so that third time I did finally get in, but because I didn't get in the second time, and the way it takes like over a full year to apply to dental school. Basically, you start like in a May. Again, you guys may know better than me now, but back then it was May, and you were applying for the following August, not the next coming, but so it's over a year. So because I didn't get in the first two times to dental school, I found a master's degree in business at Nova Southeastern, which is in Fort Lauderdale, Florida. And I was able to get into that program, and it was not like a top MBA program in the country. It's not like Harvard by any means, but it was a background that I did not have any background in business, because as you're going through college, if you're going to be a dentist or a doctor, all your time is spent mostly just getting through your science courses, let alone a business degree. So when I was applying for that third time and saying, what if I don't get in, what should I do? And I said, this business degree seems like it would be a good idea. It would round me out a little bit. And if I didn't get in, well, then I'd have some other type of background to go find a job later. And to be honest, it was like such a blessing in disguise having to do that MBA. That was probably my favorite schooling out of everything I did. Mostly because it really just started to make me understand how business works. And it wasn't rocket science. It's stuff that you could learn from reading books and stuff like that. But I just had never had a background in business. And then I thought it was really, really spectacular. And luckily, like after a month of me being in business school, I did find out that I had got accepted to the Nova Dental School. I had also gotten accepted out here to USC, but USC was more expensive on top of already a very expensive school in Nova. So I decided to stick around in Fort Lauderdale, and I went to Nova Southeastern starting in 2008. That was dental school is no joke. It is really tough those 4 years, but you get through it most of the time. And we passed the boards. You'll take 2 big exams during dental school, which are national board exams. Now I believe they're both pass-fail. At the time I was taking it, because I'm old, they actually gave you scores, I think, on the first one. And that first one kind of helps to determine whether you're going to, that first score helps to determine if you're going to get into a residency program, like a specialty residency program. Orthodontics is very popular, very hard to get into. Pediatric dentistry is also very, very popular and very difficult to get into. So back when we were taking these boards, you were looking for a very high score if you wanted to go specialize. I knew I did not want to specialize. I still got a pretty good score, but I knew I wanted to be a general dentist. At this point, I had already been in school for so long. Graduating 2012, I was 30 years old, so I had never been out of school at that point. So I was fairly certain I did not want to go to specialty school 2 or 3 more years. I was too tired for that. In dental school, I had met my wife, and we started dating at the very beginning of dental school. She also had a similar journey. She didn't have 2 master's degrees. She only had 1, but it was also in business, which was very interesting. And we were probably the only 2 people in the whole country who had business degrees while we were going through dental school. And that was very interesting, and we got along really well through that, so that was great. And then she wanted to go to a residency, and I was kind of feeling like I want to go out and work. I feel comfortable working. And then I applied to a couple of residencies anyway, and we actually both got into UCLA's. UCLA has multiple programs. They have a GPR program, which is a general practice residency that is generally focused around hospital, doing stuff at the hospital. So not really practicing dentistry, but you're doing other things. And then UCLA also has 2 AEGD. GPR and AEGD are resident programs for a general dentist. They're just one extra year of like advanced learning. GPR, like I said, is kind of based more around going to the hospital and doing hospital stuff, which I'm not really exactly sure what they do. But the AEGD, the Advanced Education in General Dentistry, is more like a private practice. It's like you sit in a chair and you do more advanced work and you go to slightly more advanced classes. And so that's kind of what I didn't want to do it, but we got it together and it was a good reason to go. And it turned out to be like a really amazing opportunity. It was a great residency program. And me and my wife are actually the only two students in our dental school year that didn't take any licensing exams, because California and a few other states, if you do a residency, you can get an automatic license. And you guys aren't there yet, but when you get to dental school and you talk about licensing exams, I'm going to be keeping my fingers crossed that they are not the same licensing exams as they currently are, because they are live patient-based exams. And you have to bring your patients and they have to have a specific type of cavity, so you could do a specific type of filling on them and other procedures too. But everything has to be very, very specific. And if the patient, for instance, doesn't feel like showing up that day, you fail. Or if their blood pressure is too high, you fail. And if there's something that just doesn't go completely correct, you fail. So it's not a great method to learning. And this one exam of you showing that you know how to do this filling doesn't really make you a better dentist. The residency program, as I'll talk about now, the residency program it makes you a significantly better dentist than if you just walk out of dental school. Lots and lots of people are able to just leave dental school and become a dentist. But dental school really only teaches you enough to make you think you know what you're talking about, but you're actually a little on the scary side, to be honest, because you don't really actually know what's going on. You just have these like the very foundational bits and pieces of it, but you find out that it gets much more complicated if you want to be a really good dentist. Obviously, if you want to be a crummy dentist, well, you could walk out of school and you go be a dentist. But if you want to be stellar, like spectacularly good, these higher level education is really important. And I suggest that if you guys can remember all this, the answer is go to a residency program, regardless of what you do after dental school. You'll be significantly better. So my wife and I went to UCLA, University of California, Los Angeles, and we did this AEGD. It was 1 year. It was based, the residency director, you have to do, as a dentist, you have to do continuing education after you become a dentist. In California, you have to do 50 hours of continuing education classes every 2 years. And so my program was directed by a young dentist, and he had gone through basically what's considered one of the highest level continuing education programs called the Cohen Center in Seattle. And then he brought all that really, really high-end dental knowledge where people who have been practicing for decades are going there to learn how to even get better. But he brought that into our residency experience and really made it probably one of the best residencies there is on the planet, and really made you start to see the mouth as a much different thing than you would see in dental school. So, and the good thing about California is they'll give you automatic licensure through if you do the residency. So that made it really easy. So we learned a whole lot and then got our licenses. And then basically right out of school, my wife and I knew that we were going to have a tough time if you're going to work in a competitive area, New York, Florida, Texas, California. I'm sure all these places plenty of other places too, that are very saturated with dentists in the areas. And it's hard to find a job. And especially as a new dentist, it's just tough in these really competitive areas. And LA and Beverly Hills is about as tough as they come in the whole world. But we were lucky. We started about 6 months ahead. So the program's 1 year. Halfway through that program, my wife and I said, we want to stay in LA. So let's start finding a job. So we basically 6 months before the program was even done, we were sending out emails to dentists in the area. We actually joined the California Dental Association, and we went through the member directory of the California Dental Association. We kind of looked at who was a member in the area. You can check by zip code. And we looked at people who had been practicing a long time because they were more likely to be looking for an associate dentist to come on. And we basically sent out hundreds of emails over a period of a few months. And we both ended up having 3 jobs coming right out of school. And one of the jobs was here at this office, and we were working together. And then the other 2 jobs we each had were at separate offices. Over the next couple of years, we realized this Beverly Hills practice was the best one we had. And we kind of worked our way into here full time. And so that was August 2013, we started here. And then by January 2016, so just over 2 years, we purchased this office from the dentist. So our office is now called the Practice Beverly Hills Boutique Dental. We do really high-end cosmetic work. We do normal work too. I've been very lucky. I've been written up in GQ and Esquire and Vogue and Hypebeast, if anybody knows what that is. We have cool patients. We have a lot of celebs like Emily Ratajkowski and Sylvester Stallone and Logic, and all these people. It was really nice to be able to work on people like this. So that's kind of like how I got here. I had always wanted to be a dentist. It was very hard, but if you keep trying, if you really want it, you can get there. I didn't put anything in here, but something that you guys should think about, I was talking to my wife about it earlier today, is the amount of loans you're going to end up taking out. I'm now, it's 2021, it's almost 8 years after residency. I still have $550,000 worth of loans. So dentistry is a great job, and it's a great career, and it's very interesting, and it's very cool, and it's very fast paced. You'll see like technology advances like crazy in this industry. So that's kind of neat. And Instagram has made dentistry very cool, but it's no joke. You have to have a strong stomach to kind of get through it all, but it is very good. So now let me talk a little bit about kind of what we do. I'll show you some like a couple of cases and that kind of thing. So this is kind of a progression of when a patient comes to me at the top, what we call preoperative, before we've done anything, and they say, listen, I want a nicer smile, or whatever the actual issue is. And so this guy, actually, he is an executive for a fitness like clothing company, and he's based out of Montreal. And he found me after I was featured in GQ, and he said, like, he came to California just to have me do his teeth. And so basically what I did is I took a picture of his teeth before, and then I take my iPad and I put that photo on my iPad, and I do a sketch. So I just sketch out kind of what I see for this person, a little lighter teeth, maybe a little longer, whatever it is. And I kind of give them my opinion on what we should do to make their smile better. At that point, I allow them to this is a discussion. Do you like this? Do you not like this? And once they say, oh, I see your vision for my teeth, or I'm starting to understand, the next thing I do, and I'll show you a little more, is I basically take models of their mouth, and I go back into my lab, and I take wax, and there's an instrument that makes it really hot, and a drip wax on this model of your mouth, this stone model of the mouth. And I literally hand carve with instruments. I hand carve that wax into the shapes and the sizes and the contours of what I want these teeth to look like. We call this a wax up. And then I'm able to, and I'll show you in a minute, I'm able to transfer that wax up design into the patient's mouth with no drilling, with no pain, no shots, and there's nothing permanent is being done at that point. And so now we're down at the third photo here. This third photo is what I call like the fitting appointment, or the mock-up is really what it is. And this is a way for that patient to see what the veneers are going to look like on them, a close estimate of what the final veneers will look like before we've done anything, before we've cut any teeth, before anything permanent is done. And generally, I'm pretty good at this part where I design out all my teeth. I actually think you've had other doctors, like maybe yesterday, I know they design their own teeth, and the people who design their own teeth when they're doing a smile is very few dentists. on average, most dentists are giving it to a lab and having photos and a model and give it to the lab, and the lab designs the teeth. I personally don't love that, mostly because I sit there and I look at this patient, and I speak with this patient, and I see how their face moves and what makes them smile and what makes them not smile. I see what they like, what they don't like, what clothes they're wearing, what, I find their whole personality, I get their whole vibe, and those things are play into how I want to design the teeth. If they like drive fancy cars and they dress really cool, well, those teeth are gonna, the light reflection on those teeth, I'm gonna make it more fancy than somebody who's very plain and understated, and somebody who doesn't like to be super flashy. Their teeth will look much more natural, much more subdued, more calm, very nice, but they'll be different. So I don't give it to a lab, because that lab is not sitting here talking with us the whole time. So I feel like my design kind of reflects that patient a little better. And then at the bottom, after they approve of it, and we go through drilling on the teeth and we take impressions, and again, I'll show you a little more. Then we get the final veneers back after a few weeks, and the bottom is kind of, we did 12 teeth on his upper arch, and the color's really nice. It's just kind of like a refined, perfected version of what his natural teeth were. A little bigger, a little brighter, a little better bite for him. And this guy's been functioning in these teeth for a few years now. He's been very happy. So here's kind of the console. I'll take this first photo with the pre-op. These photos, this girl's teeth, she definitely needs some work. We're going through getting her healthy before doing the veneers, but she is interested in the veneers. So we take the initial photo, like I was saying, and we discuss what we want. And I talk about things that you don't like in your teeth. I call them distractions. It's a distraction from having a very nice smile if you have broken teeth or something doesn't look so great. So that basically, I try to tell them I'm going to erase their distractions so that they can see their natural beauty or their natural smile looking like it should, basically. So I can sketch these teeth out right in front of their eyes. Then this is, here we go. Okay. So this is the wax up. So I literally took a model of this girl's mouth on the top up here, and then I literally drip wax and I hand carve these teeth back to the shapes I want them. And then I take this, what we call a putty matrix, and that putty matrix, it's like a putty that I mix together and I push onto that wax up. And once it hardens in about 2 minutes, I take it off, and now you can see it at the bottom, and it takes the shape of the outside of that wax up, of that design that I used. Then I'm able to take that and I fill it with this stuff we call bisacral, and it's a tempering material. It's like in tubes, and we have a little gun that extrudes. It's just like liquid. So I put liquid in this blue mold, this liquidy white material, and I fill this thing up, and then I push it onto the patient's teeth. So push it on right over her natural teeth. And after 2 minutes, this material hardens. So it was liquid, and it will take the form of the underneath of her teeth, but it's in this matrix thing what we call a matrix, and it'll take the outside shape of the new design. So in 2 minutes, this girl went from the top picture to the bottom picture, and it gives you a very good idea of, are we going to like my design? Do we like it or not? And if she doesn't like it, we can shorten them or add material to. These are just plastic, and we can use liquid filling material, and we can change the shapes, or we can shorten them with drills and stuff, and we can get an idea of what it's going to look like in her mouth. And she was very happy with this. I think she looks very good compared from one photo to the next, and that kind of gives us the blueprint for what the final teeth are going to look like. This gives us, we're going to use the same thing after we've drilled on the teeth to make temporary veneers. So let's see. Okay, so I'll talk about that a little bit right now. This is what we call this case is a full mouth rehabilitation. This is where we're literally going to work on every single tooth in the mouth. It doesn't get much more complicated than this case. This guy is in his 70s, and only recently started to break teeth here on his left side. So he broke a tooth here, and they placed an implant before he came to me, and then he broke a tooth right next to it, and we placed another implant. And then he broke this one down on the bottom. And at first we were going to do a bridge, but we decided to do an implant. So anyway, so this guy started to have problems. And if you look at his mouth, his teeth are really short and they are not especially great looking, kind of bad colors. He doesn't take care of them that well. There's some old dentistry that you can see here in the back where you see like the margins, which isn't great. And he didn't really care about the cosmetics, but the function of his teeth was not really working anymore. So I did a wax up for him, and then we tried everything in. Okay, well, it's going to look like the bottom. But anyway, so he said okay to the whole case. And he said, okay, let's do it. So then basically, after you say okay and you have that wax up and you're ready to go, then you prep the teeth. For this case, I'm going to show you other cases that are significantly different. This case, we did full mouth crowns in his. So a crown goes all the way around a tooth. These are more minimally prepped crowns, which is really less drilling is becoming more popular because less drilling on a tooth is healthier. The tooth stays healthier. Any fillings or crowns that are on a tooth that has enamel's the outside layer of the tooth. If you have enamel on that tooth, everything lasts better. It's just healthier and lasts longer. So what we try to do with these crowns is make them very, very minimal prepped. It looks like I drilled off a lot of the tooth from here, but this is all measured out, and almost all the preps in the front teeth are still in the outside layer of the tooth. And when you have the outside layer enamel on the tooth still, the tooth is less flexible. And like I said, everything lasts longer. Some of the back teeth had already had crowns and kind of needed to be redone. But we drilled on all the teeth on the upper and all the teeth on the lower. And we put them in temporaries. So the top 3 photos are the before pictures, which I already showed you. These bottom 3 photos are him in the temporaries. So the teeth are a little brighter, a little big, a little longer, kind of restoring some of what he had worn away over time. I changed the gum line here on the front lower teeth. The gums came up really high and didn't look very pleasant. And then I do I call it gum tailoring, or gum tailoring. It's called aesthetic crown lengthening. So I removed some gum tissue and I also removed some bone underneath that, and in order for everything to look nice and kind of be even. So there he was in his temporaries, and this case actually took about 6 months in total, 6 or 7 months in total to finish everything. It was a very, very big case. So here, can you guys see both photos? Because so this left side is the before, and the right side is the after. Once we've actually finished, he's no longer in temporary. These are temporaries. These are the final ones. And this is kind of what the before and after's final stuff looks like. So now he's in all full porcelain teeth. He has 3 implants. All the rest are natural teeth. So he has 25 crowns, 3 implant crowns. We did the crown lengthening on the lower gums to make the proportion of the teeth a little nicer. And he looks really spectacular. If I was allowed to show you face photos, I would show you the face photos. But he would prefer not to. But no joke, this guy looks at minimum 10 years different. And the only thing we did was his teeth. We changed the height of his teeth, which is called changing the vertical dimension. And it kind of made over time, as teeth wear down, your bite gets tighter and tighter, kind of shrinks on yourself. Then your skin starts to shrink, and you get wrinkles and sagging and stuff. And what we did with him is we added some thickness to the front part of his teeth. So his lip doesn't, every 10 years, a lip will go lower. Your upper lip will come down 1 millimeter, and every 10 years, your lower lip will come down 1 millimeter. So when you're young, you show a lot of upper teeth, and when you're older, you start to show a lot more lower teeth. So with him, what we did was these top crowns are a little thicker coming out towards the lip and the cheek. so it supports the lip and kind of almost raises the lip a little bit. We also made the teeth a little bit longer to restore some of the teeth he lost. And we also made the back teeth taller, and his bite is now different. So his face is actually a little bit longer. But what it does is it kind of stretches out the wrinkles. He doesn't have as many wrinkles in his face anymore. So this is part rehabilitation. This is part cosmetic dentistry, and this is part like anti-aging type of cosmetic procedure where his whole face literally changed from one photo to the next, and the only thing we did was teeth. So that was a really nice case. That was a 70-year-old guy. Now we're talking about an 18-year-old girl. She's the daughter of like a very famous actor, and she had a very cute smile. Her teeth are nice. There's nothing really wrong with her teeth, but she felt like it was a little young. She was about to go to college, and she wanted to look a little more mature, and she didn't love her teeth. So basically, the top of all three photos are the same. They're all her before photos, and what we did with her was 12 completely no prep veneers. Prepping is drilling on the teeth. The preparation of the tooth is drilling on it. I did not drill on any of her teeth, not even a little bit. When you're 18 years old, the truth is every piece of dentistry you have is going to have to be redone at some point. Dentistry lasts, you're talking somewhere between 5 and 30 years for the most part. Things can last longer, but that's rare. And at some point, most dentistry is going to have to be fixed or redone at some point. So the idea for her is at 18, she's most likely going to have these teeth worked on probably 2 more times in her life. So the idea, like I said before, the more natural tooth structure you have, the healthier the tooth is. So now what I did is I did not compromise her teeth at all. I did nothing bad to her teeth. I designed out completely no prep veneers that went on the outside of her top 12 teeth, but didn't interfere with her bite. We didn't drill down her teeth. So if I was to literally cut these veneers off, we would go back right to what she looked like before, and there would be no damage at all. So for somebody 18 or very young, or somebody who has nice teeth and just wants to like tweak them, the idea, for instance, my mom, she's not that young, but I don't like drilling on my mom. She's a tough patient, but she wanted her teeth done. So I also did lots of no prep veneers on my mom, and it's painless. Basically, it's very, very easy for the patient. It's very healthy for the patient, and those will last a really long time. And she looks great, a lot more mature, and a little more bold of a smile, a little brighter, a little bigger, a little wider. So they were really happy with that. Here's a ton of other cases. Some on the top 3 are like a little more natural of a smile. I call it idealized natural, meaning the best version of your natural teeth possible. I want to look at your teeth and say, if I was going to give you your teeth but better, what would they look like? So if you look at some of these top ones, they still look very natural. This last one is very bright compared to her natural teeth. But if you look at the shapes and where the light hits these teeth, it's very similar to what their natural teeth, the shapes and kind of where the light was reflecting is very similar. The bottom row of teeth I call stylized natural, meaning I'm going to give you teeth or veneers that look like teeth, but they don't necessarily look like your natural teeth. They're like a little more perfect or a little brighter or a little more like character to them, and they don't really follow exactly what your natural teeth look like. So the bottom is actually more than just a set of veneers. This bottom guy here, he was missing 3 teeth here in the front, and like the front 7 teeth are stuck together. And he had this old bridge that was no good, and we made him a new bridge with pink porcelain to make it look like he still had gum tissue there, which turned out really nice. He's actually a famous singer, and he loves that. That looks really great. The middle one here is also another very young girl. She's probably in her early 20s. And these weren't no prep, but these were drilled so minimally that she didn't even have to really be numb for them. But they're obviously a different shape. They're much brighter. They're a little more fancy than her natural teeth were. And then this last photo is actually my mom, and I didn't want to drill on her teeth. She lives far away. She lives in Florida. I'm in California, and I knew drilling and having her be in temporaries for a long time was kind of scary. So her front 6 teeth are completely no drilling. And then I had to replace bridges and stuff in the back. So that's some of the stuff for the actual cases. Technology. We use a whole bunch of technology currently, and then we just partner up with another doctor that we're going to start this partnership towards the end of the month, that we are basically going to be one of the most technologically advanced offices on the planet. So right now, what we're looking up in the top left corner, this black camera is an intraoral camera. It's essentially just a photo. It takes photographs of the teeth. It's just tuned so that you can get real close to the teeth and get a very detailed view of the tooth. Going right next to it is another thing called the DEXIS Carry View. That camera takes the picture up on the top left, the gray and white picture. What it does is it lights up the tooth with the little 2 arms on the side here. These little arms have a light, and it kind of goes over the tooth. And there's a camera that goes onto the biting surface of the tooth, and it uses near infrared light to essentially illuminate the tooth. And because the tooth is kind of like glass, you can see through it, and this camera is able to take a picture, and there's a cavity on that tooth. That dark spot is a cavity. These 2 cameras have no radiation, so not a lot of dentist offices have this Carry View camera. We've had it for probably 5 years now, and it's really great. It's a great way to check a tooth with no radiation. There's nothing bad about it. It's excellent. It doesn't give you all the views of an X-ray, but it's a really nice tool with no radiation. Underneath the gray picture, the black and white picture is an intraoral scanner. That's our iTero machine. And basically that is a wand style camera, and you scan the whole mouth, and it builds a 3-dimensional digital model of your mouth, and you can move it around. It's touchscreen. You can open it up, and you can see the bite, and it's really great, very interesting. We use it for Invisalign and record, and just taking records for the patient. When I drill a crown on a tooth or a veneer, even sometimes we scan it and we send it off to the lab, all digital. We don't take any of the gooey impressions anymore. Sometimes we do for the big cases. They need gooey impressions, but much less of them now. Back to the right side, we have this like square rectangular thing. That's our X-ray sensor that plugs into the computer and takes digital X-rays. Much less radiation than your old school film X-rays. Down there at the bottom, the thing called the NV Pro 3, that's a laser. I use a laser to cut gum tissue sometimes to make it look nicer or something like that. Some of the other kind of interesting thing, the top, this pink and white thing, that is what's called an easy shade, Vita Easy Shade. It's called a spectrophotometer. It's a little tool that you put it up against the tooth and you press a button, and it shoots light into the tooth, and then it reads what comes back at it. And then there's a code, like it will say 2M2 or 1M1 or something, and that code corresponds to a tab. So this tab on it says 1M1, and basically that's a specific color. All the labs have these things. These are called shade guides. So dentists and labs have these. I use this gun. I click on the tooth. It tells me what color the tooth is. I go to these color tabs, and I pull that tab and I put it up next to the tooth, and then I use one of my big fancy digital cameras, my DSLR cameras, and I take a photo, and I take that photo and I send it to the labs, and then I tell the lab, I think the tooth is the colors 2M1, 2M2, 2M3, and I send them photos, and they're able to look at this shade tab and look at the tooth and get a comparison. And because they have these shade tabs also, they're able to make my final crown or my final veneer the exact color I want. There's an iPad. Obviously, you guys know what an iPad is. I use that to sketch out the smile designs before we've done anything. And then coming to the new stuff that literally nobody else had. Well, the middle thing some other people have, but this thing all the way to the right with the blue tube, that's called a Maverick TheraSmile. That is the first automatic whitening machine that basically you stick the tube in your mouth, and it creates a vacuum, and it puts bleach onto your teeth, and it doesn't touch the rest of your mouth. It only stays on your teeth. and it automatically bleaches your teeth. The doctor, Dr. Sean Pierce, from Newport, just south of where we are, he was the first one in the country to have this machine for like the past 2 years. He's been the only person who has it. He's been testing it with the company. I think 1 or 2 other doctors are now starting to test it too in other areas, but we will be the first office in Beverly Hills who has it. Not only does this machine bleach teeth, but you can put a gel that softens like the tartar on your teeth so your cleanings are easier. There's a desensitizing gel, so if your teeth get sensitive from the bleaching, there's a gel we can put on your teeth through the machine. There's also like gum treatments with like essential oils that you can do. So that machine is very cool. There's probably like 3 or 4 of them out in the whole world. We'll be one of the first people. The middle machine right here is a cone beam CT machine. That's a 3-dimensional X-ray, and you can kind of see what it looks like, what the X-ray would look like. If you look at the top right picture up in those screens, you can see like a mouth. It kind of gives you that X-ray machine takes that style X-ray. And we use that. We'll be getting one of those machines. Other people have those machines, but we'll be getting one in our office to use with this machine called the Yomi dental implant robot. There's only about 60 of these in the whole world. The Dr. Sean Pierce, he owns one in Newport, and he's actually now the only owner of 2 of these machines. He's the only person in the world who has 2, and he's putting one in my office. And what this does is you take that 3-dimensional X-ray and you put it into the computer, and you can plan where you want an implant to be placed, like exactly perfectly in the bone, and you press OK, and then that robotic arm has a little drill on it, and basically you're going to place the drill where it needs to go, but that arm will not let you go anywhere. It won't let you go too deep. It won't let you go too much to the right, too much to the left, too forward, too back. It keeps you perfect. And the great thing about this is if you needed to change something, you can change it on the computer and you press OK, and then the arm gives you the new plan, and it is the most perfect version of an implant possible. So we'll be the first ones in Beverly Hills to have this machine too. And then this bottom machine is something that is being used in Europe by a couple of dentists in Europe. And has recently, the European company that owns this machine just partnered with a company here in New Jersey. And I happened to contact that company very, like just a couple of months ago, right after they did this merger. This machine is very popular. I'm sure, especially the girls have seen the light mask, a mask that you put on your face and it has red light and it's kind of good for your skin. Well, that's called low level laser therapy, or light therapy, basically. Those are becoming very popular in cosmetics. This machine is a medical grade light therapy device. It has different colors for different things. And I think I will be the first person in the United States that will be testing out this machine soon. It helps to heal things a little quicker. If you have an implant placed, that's a surgery, and then you put this light on your face and you tune it to the correct color, and that color will help to make you feel better, basically, and help you heal up a little quicker and lessen how painful it is and get rid of inflammation. It's good for your skin. It's good for a few different other things. And so we'll be some of the only people in the area to be using these devices, which will be very, very cool. And I believe that's kind of my presentation. I hope it kind of hit some of the things you guys wanted to hear about. And then, are there direct questions? Do you guys have questions?
Yeah, thank you so much, Dr. Cohen. So we actually have a few questions in the chat, if that's all right.
Great. I don't see anything, so you just tell me and I'll answer it.
Yep, sounds good. So the first question is, have you ever had any cases where something went wrong, like a aesthetic impeded function?
Like went wrong with my treatment?
Yes, I believe so. That's what the person asking.
I mean, in reality, the way I do this stuff, I get to work out the kinks ahead of time. That's why I take the photos. That's why I sketch things out. That's why I do my own wax ups and mock it up in the patient's mouth so that we kind of eliminate those problems ahead of time. Have we had issues after the fact or when the veneers come in? Yes, very, very few. And generally those patients are the more difficult ones, because the people who are kind of very, normal patients, they kind of understand what's going on and they're fully informed. But yes, you'll have sometimes people don't love what came back. But I can only think of maybe 2 or 3 patients ever. And it just depends if they look at it ahead of time. When you come for the veneers to deliver the veneers, I try them in and I show you them beforehand. And that basically, I say, do you like these? And most people, it's either they love them, or if they have an issue, basically we discuss the issue, we take photographs, I take them off, I send them all back, I put the patient back in temporaries, and we have whatever is fixed. There has been a couple of cases where people made me cement the teeth and then came back months later and said, I don't like it. And some people, it was not really a true valid concern, because that there wasn't much better anybody could do. Other times we've cut a few teeth off and redone them. Nobody's had any major issues. Nobody's had any major functional issues. I work very, very hard at training and understanding how the function of teeth work and that kind of thing, so that we don't have functional problems later. We've had a couple of very minor issues with cosmetics, but we try to work those kinks out ahead of time.
Great. Thank you so much, Dr. Cohen, for your presentation. It was very informative. Another question we have from the chat is, what does it feel like for a patient when they have teeth shaved down? Is it painful?
No. You're definitely numb throughout the whole procedure. And what I generally hear is during the procedure, I'm making sure you're numb. Nobody's feeling much. The shots aren't the greatest. No, everybody knows they've had a shot and it's not the greatest, but even the way I do the shots is slightly different than other people. And I try to make that more comfortable than normal. And then what I would say is, the answer is no, it's not really painful. What I hear most of the time is after that day, they go home and they kind of feel run down. They're tired. They're a little sore. They know their gums have been a little irritated. They know things have been worked on. But literally, I get calls all the time, or I call people the next day, and literally by the next morning, everybody's like, oh, I'm fine now. No big deal. I literally, knock on wood, never prescribe pain medication. No prescription pain medication ever at my office. It's never needed. Advil and Tylenol takes care of all the pain or discomfort that you're going to have, which means it's really minimal. While you're in temporaries, the temporaries aren't like stuck on there the same as strong as they would be when you do the final veneers. So sometimes people notice like minor sensitivity when they drink something very cold or something like that. But again, I also try to cut very, very minimally on the teeth. And again, the more natural tooth structure you have, the less problems you have with pain and stuff like that. So we luckily don't have a lot of pain problems. And in general, no, it's not a very painful procedure.
Thank you so much for your response, Dr. Dustin. Another question we have is, how does one develop the artistic vision? Do you have any tips on how to develop this skill?
Yeah, this is kind of, if you want to be, again, your average dentist, it's whatever, you don't really need it. But if you want to be something special, it's training is really going to make you understand what a tooth needs to look like or not. So for instance, going to the classes I explained before, again, this is like way past you guys. You aren't even in dental school yet. So that I don't expect you to remember this exact thing, but the idea is, the higher the level of training, the more you're going to understand on what's going on. And really, the classes at the Cohen Center in Seattle teach you like the fundamentals of dentistry. They do teach you cosmetic aspects, but they're not like the most high-end cosmetics. But knowing how the mouth functions will let you know what you can make a tooth look like and where it can go and where it can't go. And then as far as the thing that I believe was the main factor, two things really, but the main factors in me kind of creating my vision of understanding what I want in the cosmetic work. The American Academy of Cosmetic Dentistry has a yearly meeting, an annual meeting of a big conference. And when you go to this conference, you can take all these courses. you can be an accredited member, meaning you go to certain classes and you do certain types of cases and you take photos and you submit it to the association and the academy, and they decide whether you're good enough to be an accredited member or not. And basically, I'm not an accredited member. I'm not really even trying to be an accredited member. But what I did feel like was extremely beneficial was taking the courses that taught you how to become accredited. Because what they did was they went over a list of like 100 or 200 points. I don't know, it was like a lot. It was like 100 points that they looked at every tooth and said, does this tooth look good according to these 100 points? And I'm saying 100 things on one tooth? How is that possible? But then when you realize there are literally hundreds of things you could see in a tooth, then you start to say, oh, whoa, this is much different than what I saw a tooth before. I saw it as white and I saw little things about it in dental school. But when I went to these classes and did the accreditation courses and how they were going to grade you and how specifically they looked at the teeth and the veneers you were making, that really started to pique my like, oh my God, I have to be on a different level. I got to see things much differently than I did before. And then also Instagram, has actually become, Instagram was not even I don't even know if Instagram was around when I was in dental school, but it certainly was not what it is today. And especially for cosmetic dentistry, there was no huge display of cosmetic dentistry even 12, 13 years ago when I was in school. Nowadays, Instagram, you have access to so many high quality photos of extremely good cosmetic dentistry from all over the world, that you're able to look at his case and say, that looks amazing. And then you'll go to another case and say, whoa, that one looks amazing. That other one doesn't look so good anymore. And you'll start to realize things over time. You'll realize certain labs do better work than other labs. And when you see that work, you'll start to say, oh, I don't want to use this lab I thought was good. I want to use this guy. They're a real artist. So there's levels to it, and it takes time. But the other thing is waxing up your own cases. You'll do that in dental school, and 100% of people will complain about waxing up in dental school. They hate it. They hate it. They hate it. I hated it when I was in dental school. When I was in residency, I was like, no way am I ever waxing up anything. But then something changed in my brain and said, you know what? You got to pay for this wax up, and that sometimes is very expensive. You're talking about $60 or $70 a tooth that they charge you to do a wax up at a lab. And then if that patient doesn't want to pay for it, then you're deciding, do I want to do a wax up? How do I get them to do veneers on their own? Whereas then I started doing the wax up on my own for free initially, and I don't do it for free anymore because I'm good at it. But I did it for free, and that started to get my hands on, could I make a tooth look the way I wanted? And at first, it was definitely not the way I wanted it. And the more I learned from all these classes and Instagram and stuff, and the more I did with my hands, I started to realize, like, okay, now I've got the vision of what I see, but it takes time. I mean, I've already been out of dental school since 2012, so it's only maybe the past 3 or 4 years that I've been doing lots and lots and lots of high-end cosmetic work. So it takes time, and I even feel like I'm better now than I was 3-4 years ago when I was starting, and I feel like even the cases I do now are better than the ones I did last year, and I just feel like you have to keep building on top of it. But the training and looking at cases that you think are really nice and then finding new ones that you think are really nice, those will start to shape your eye and your brain around what things are supposed to look like.
Thank you, Dr. Cohen. So the next question is, how has working as an associate compared to owning your own practice? Like, what are the pros and cons to each, and how does that differ with you working with like different clientele?
Yeah, so, I mean, as an associate, I mean, to be honest, I grew up with my dad owning his own business. My parents are not in medical, but my dad owned his own business. So it was always kind of a thing, like, in my head that I was going to work for myself. I mean, that's part of why I went to the MBA program, was because I knew I'd work for myself. So I'll be honest, I wasn't a huge fan of being an associate because it's not your office. I like to be kind of the boss. And so that part of being kind of told what to do in a way and having to kind of do things the way other people wanted to do them, that wasn't my favorite. the great things about an associate that you don't even realize at the time is you have so little responsibilities at the time. All you're doing is the dentistry. You don't have to worry about how the employees are doing or how the business is running. It's like you just walk in there, you do your dentistry, and you're done. And that part was kind of nice in a way. Because now that I'm a boss, I like being the boss because I like things going my way. But then you realize when you're a boss, almost nothing goes your way. It's a real struggle to get it. You know, you have to put out all the fires. You have to have all the answers. You've got to figure it out all on your own. To a certain degree. I mean, obviously you can ask for advice and stuff, but when you're the boss, everything stops with you, meaning you have to make all the decisions. You've got to make sure that you're making all the right decisions. You know, owning your own practice is better financially. You as an associate dentist here in LA, you probably get paid a lot less than you would in Texas or Florida even. Because of how competitive it is. I know I was offered jobs in Texas, which I didn't have a license for at the time, but I was offered jobs for like $800 guaranteed per day that I worked in an office. And here in California, we're guaranteed like $425 a day, and you may be able to make more if you did a whole bunch of work for that day. So owning your own practice is better financially, that's for sure. But it also it's just a lot more on your plate. As far as the patient clientele, I mean, as an owner, I feel like more of the established clientele, you know, our high net worth individuals and our celebrities and stuff like that, they'll see me, whereas maybe they wouldn't see me when I was the associate because they didn't really know if I was going to be around or if I knew what I was doing. But now I've been here a long time and they know I own the practice, and I see almost all the patients now, because the other doctor we bought the practice is kind of on his way out. He's only working one day a month. And so that part's nice as an owner. They see you a little more, you know, legitimately. But it's also harder because now if they have a problem, they're all yelling at you. So there's good and bad things either way. I personally would prefer it where I'm the boss. My wife's really the boss. I'm almost the boss. But I like that we own the practice.
Thank you so much, Dr. Cohen. Another question we had in the chat was, what's one piece of advice you would give to a future dentist that you wish someone would have given you?
I mean, you know, I wish somebody had given me. I was fully informed. I would try to be a dentist since I was 8 years old, so I kind of fully knew what was going on. I mean, the biggest thing I would think, the biggest thing that there's almost no way to prepare for is how difficult dental school is. I went through 2 master's degrees. I thought I had taken lots of hard classes. I thought I had already done these high level courses and was going to be like, it'll be fine in dental school. Everybody from dental school is telling me, yo, this is hard. Like, there's a lot to do. The time management is very difficult. Lots and lots of course load. And I'm saying, yeah, I have 2 masters. I'll be fine. And then when you walk in, you're like, oh my God, there was no way to explain this to me. So I would say the best advice is, be prepared for basically the toughest thing, tougher than you can imagine, going into dental school. And there's no real way to prepare other than acknowledge it's going to be harder than anything that you've ever done in undergrad. I mean, not to knock anybody's undergrad. I'm sure University of Florida was much harder than my high school years. I didn't do that well. University of Florida College was much harder. But dental school is like on a level that you can't even understand. As far as anything else, I mean, dentistry is good. It's an expensive thing to go through the school. It's an expensive business to run. And it's kind of high stress. I tend to be probably a little more high stress than other people, but I put the weight on myself to be world-class good. I don't want anybody to be any better than me. I'm not saying I'm better than everybody, but I don't want anybody else to be better than me. I want to be as good as they get on the planet at everything, the customer experience, the business part of it, the clinical part of it. So as a dentist, you have to do much more than you do in other jobs. You are the clinical person. You have to take really good photographs. You have to know your technology. You have to be able to take care of that patient. You got to be able to run the business. So, being prepared that you're going to do a lot more as a dentist than the average MD doctor will be doing. They're not taking photographs like you are. They're not doing, your internal, your average general physician. They're not taking photos. They're not waxing up teeth. They're not doing surgical procedures in your mouth. They're kind of chatting with you, and they chat with you and then write stuff up and ask you questions and then send you off to somebody else to do something. So as a dentist, you have to know you are going to have a whole lot more hats than most other professions will have. And you got to make sure your personality is right for that, and you're able to do it. Obviously, you don't have to do it as high stress or at the same level as I'm doing it. There's lots of dentists who love what they're doing, and there is no stress. But if you want to be a high-end cosmetic dentist and you want fancy clientele and you want them to pay your fees to do these big work, there's just a lot to it.
Thank you so much, Dr. Cohen. Another question we have, during your 3rd or 4th year at Nova, did they provide you patients for your clinical component, or did you have to find them yourself?
I'm pretty sure they give you patients to a certain extent. I don't think you're really required to go find your own patients. Obviously, you can bring in your own patients, if you do have people, but no, schools generally give them to you.
Thank you so much, Dr. Cohen. So unfortunately, that is all the time that we have for questions today. We just wanted to say thank you so much for taking the time to be here with us and for answering all of our questions. We really appreciate it.
Oh, no problem. Thank you very much for having me. I hope it was somewhat useful and somewhat helpful, but really, thank you very much for the opportunity. I appreciate it.
No, thank you. And for everyone who joined our session today, the post quiz will be posted in our group me.